Welcome, everybody, in the fibrolamellar community. My name is Dr. Paul Kent. I'm the medical director for the FibroFighters Foundation, which is dedicated to increasing the knowledge of this very, very rare disease, and bringing together experts and helping the many patients and doctors out there. Today, it is my privilege to be joined by Dr. Dan Delitto of Stanford University, a hepatobiliary cancer surgeon. Welcome, Dan.
Thank you so much, Paul.
Can you tell us a little bit about yourself and your background and your interest in this disease?
Yeah, absolutely. So I grew up in Pittsburgh. I did a short stint in biomedical engineering at WashU, and then came back home for med school at the University of Pittsburgh. I went to the University of Florida for my general surgery training and took a little bit of time there to do a PhD in cancer immunology. And that's where I met my wife, who was a postdoc in the lab at the time, and then went back to residency and went to Johns Hopkins for a surgical oncology fellowship, and did a little bit of time as a postdoctoral fellow there as well under Elizabeth Jaffe in the lab, again on tumor immunology. Also there got the opportunity to meet Mark Yarshwin and really, got, I think, a much broader exposure to patients with fibromellar cancer, and then took a job at Stanford, and I've been here a little over 3 years now as a surgical oncologist and hepatobiliary surgeon.
Great. Thank you very much. We know those doctors very well. Dr. Yarshwin is a member of our tumor board. We have had 20 patients or more with him, and Dr. Jaffe as well. We also know quite well. So that's wonderful to know that you're connected with these experts. So for our patients out there who may be just learning about this diagnosis, and they may have heard that it's hepatocellular carcinoma, or they may have heard it's connected or related to hepatocellular carcinoma, but it's not. And that's very confusing. So I always like to ask our doctors, how do you think of fibrolamellar carcinoma differently than hepatocellular carcinoma? How do you think about it differently? How do you approach it differently?
I think the patient approach is totally different. The big concern with most hepatocellular carcinoma is the rest of the liver, in that, you're dealing with a lot of much sicker patients with fibrotic livers with cirrhosis. And so you have to tailor treatment for that aspect of it. With fibromellar, it's a totally different patient population. And you really have to approach these patients differently because the things that you worry about long term are not the same at all. And so I think much more aggressive approaches are warranted, whereas we tend to hold back on folks with cirrhosis because we're worried that the treatment could be worse than the cancer itself.
Yes, thank you very much. We couldn't agree more. These are patients in the prime of their life. We've never had a fibrolamellar patient with liver disease, not even one. Hepatitis or alcoholism, none of that. It's great to be able to work on such healthy patients because they heal so well and they tolerate so well. And plus, they have 60 years to live or more, and we want to give them that opportunity. So it's wonderful to hear you express that as well. When would we consider a transplant for fibrolamellar carcinoma? When does that make sense, in your approach?
Yeah, that's a really good question. I think, when you think about transplant for hepatocellular carcinoma, you're really thinking of a long-term treatment for the liver itself, the liver disease itself. And really with this, their liver is otherwise fine. And so when you sort of bring transplant into the algorithm, is totally different because you're not thinking about a long-term treatment for their liver disease. And so, I think for this disease, when resection is possible, it makes a lot more sense than moving down toward transplant.
Great. Thank you very much. Now, in a lot of literature that you read, and of course, patients understandably are going to look at on the internet and find information, the first sentence will say something like fibrolamellar is a surgical disease. The only way to cure it is to do surgery. And then something like there is no systemic approach. We would argue that it's a systemic disease and you, of course, need surgery. Tell me what you've learned or experienced in terms of how to approach this, surgery with systemic therapy or both or either.
I couldn't agree more with you. I think it absolutely is a systemic disease. We see even with perfect surgeries, recurrences here. And when we tend to say something's a surgical disease, you can get into this game of whack-a-mole where you keep having to do more and more and more surgery, and then eventually there's so much scarring that you just can't do it anymore. And so I think any cancer with a high recurrence rate should be treated as a systemic disease if you can. And I think as we push boundaries, we're realizing that we can treat this as a systemic disease, and it's much better for the patients.
Great. Thank you so much. Now, as I said, our average age is 19, so we have patients as young as 6, lots of patients in their early teens. And of course, they would love to come to Stanford. Who wouldn't? What a fabulous institution. Can you take care of patients in that age range?
Yeah, absolutely. There's a pediatric surgeon here who I work very closely with on cases like that. And so it's not a problem at all to get them in.
Why is it important to go to a big institution such as Stanford as opposed to going to the surgeon that may be associated with my community hospital? What advantages does that present?
I think one of the big ones is coordinating care. You when you plan surgeries for something like this, it's always in conjunction with other treatments. And so if you're not at a larger center, at least you need a really good plan for coordination of care. And that's where FibroFighters has really been so impressive to me, because it allows us to do that without a patient getting all their care at Stanford. I think the other advantage is, you want people who've done a lot of these surgeries before, because they know what to look out for afterwards. And they know, when to push limits, which I think for a lot of these patients is very reasonable given their age and how much life they have left to live. And so, but you always have to be cognizant that, you don't want to do anything that's going to cause, irreversible harm to the patient. And so, I think, bigger centers tend to have more of these experts. And, with me, my partners and I are very, I think, helpful to each other in terms of just being a second or third set of eyes to talk about the best way forward.
Thank you. That's great. We, as you know, offer a free multidisciplinary and actually international tumor board. How is that different than the tumor board that you have at Stanford or as you have at your own hospital? Why is that necessary?
I think, we have tumor boards that are geared toward types of cancer that are much broader. And so you do have experts in pancreas cancer or typical hepatocellular carcinoma. But I think the way you're treating fibrolamellar is very unique, and you really do need people who are used to treating it getting together and talking, because I think having a typical patient go through the treatments that some of our patients have had it would be almost impossible in a single center, and having that cooperation and the coordination is just it allows us to do things that we can't ordinarily do.
Great. Tom, any other questions you'd like me to ask?
No, I think we covered everything, and we're just really glad to have Dr. Delitto on the team. I think this is a great opportunity. We've always been looking for someone on the West Coast because, as we know, our patients, it's pretty tough for a lot of them to be traveling across country or even to the middle of the country. So, Dr. Delitto's helped with several patients now and has a few more to go. And so we're just really excited about the relationship and Stanford being willing to help our community.
Oh, yeah, absolutely. Couldn't be happier to help.
Dr. Delitto, are you available for second opinions? And why is it it's a lot of effort for the family, but why is getting a second opinion important?
I think especially with surgeries for rare diseases, it's just extremely beneficial. Often you're caught between a rock and a hard place, and even just having a different perspective and a different, if it's the same, even if someone's offering the same treatment, leading to it in a different way and offering a different perspective can really lead to a lot better understanding and a lot better cooperation. And so I always encourage it for something like this.
Yeah, thank you. And that, to me, that's such a good sign, Dr. Delitto, for you, and a compliment. I think good doctors always recommend a second opinion, because if they say exactly the same thing, that gives reassurance both to the family and to the doctor. And if they offer a new perspective, then we all learn something. We all do a better job, and ultimately it's putting the patient's needs first. So thank you for that.
Yeah, absolutely.
It's been a real pleasure to have you join our tumor board and participate. And I want to thank you for taking the time out of your busy day to be with us today.
Of course, my pleasure. Thanks for having me.